The newest recommendations that have come out in the past year is that everyone who's age 45 and greater, even at their average risk, so no family history, no symptoms, that they should be getting colon cancer screening.
Well, colon cancer is the third most common kind of cancer that somebody can get. And it's the second most common cancer killer, second only to lung cancer. So it's more common than people realize. The thing that's so tragic about it is that it is almost entirely preventable. So with screening, we find these precursors to the cancer, these polyps, and we remove those, and that prevents most colon cancers from forming in the first place. So people who are screened very rarely develop any colon cancer, and if they do, it's caught very early when it's most treatable and almost always in a curable situation.
So both genetics and environmental factors play a role in development of colon cancer. So for family history of colon cancer, anyone who have a first-degree relative, including parents, siblings, or multiple family members, especially if they have diagnosis at age less than 60 years old, then those people are at increased risk of colon cancer. In terms of other risk factors, including obesity, tobacco use, excessive consumption of alcohol, or excessive consumption of processed meat, and lack of physical activities are known risk factors from observation studies that associated with colon cancer.
Well, I think for colonoscopy, I have to say that there is an inconvenience that's associated with that. You end up having to do a colon prep. You have to have somebody, give you a ride, and for some it's an uncomfortable, just embarrassing, maybe is the word that I should use, procedure. But that embarrassment that you might have could literally save your life. And by getting the colonoscopy at the age recommended, at the interval recommended, that is probably the single most important thing that you can do to prevent going on to have a cancer that could shorten your lifespan.
And I love this question because this is something that really can start at home. I grew up in a rural Midwestern farm. We didn't talk about family history. We didn't talk about our health around the kitchen table. So really, this is a conversation that can start at home because we know that it works. We know colorectal cancer screening works to prevent colon cancer down the road. We love our family members a lot, right? And so we want to have this discussion not only in the doctor's office, but also in the community and also with our family at home. So one thing I would always say to the family members, if you want to have this discussion, is at least have the discussion also with your doctor and find out the different options. And what option is best for me? Is it best to go ahead and get that screening colonoscopy? Or maybe is a stool-based study like a Cologuard or a FIT test best for me?
Well, there is a point when after you are in the procedure room and after you are asleep, we do have to expose your backside. There's no way to avoid that. But our crew is absolutely wonderful about just protecting your dignity. It's a very common procedure, and we just make sure that everybody who comes in, that their privacy is respected, that we make it as easy as possible as far as getting in and getting out in an efficient way, and your dignity is just preserved every portion of the way. And like I say, it's a very, very comfortable procedure. We keep you sleepy, and a lot of people wake up afterwards and they look up and they say, "When are you going to start?" And we say, "Too late, we're already done."
So most of the insurance should cover a colon cancer screening, either by colonoscopy or the stool test, as this is one of the preventative measure. So I encourage you to discuss with your primary care provider and also your insurance.
Unfortunately, if one develops symptoms, that is very late sign of colon cancer. And most colon cancer or colon polyp, it is symptomless, they are symptomless, no symptoms associated with colon cancer or colon polyp. As I said, if one develops symptoms, unfortunately, that is too late. So we don't have to wait for a symptom.